Over 60 and waking up to higher than you'd like fasting numbers? Try this simple bedtime drink, done the right way, and a small ritual around it. It's not a cure, but when used carefully and consistently, this one nightly step may help support steadier glucose overnight and give you a better morning reading. Listen closely. The timing and the safety checks are just as important as the mix itself. Why nights matter for blood sugar, especially after 60. As you age, hormones and kidney function change. The dawn phenomenon, a rise in early morning glucose driven by overnight hormonal shifts, can hit older adults more noticeably. Your kidneys also process fluids and electrolytes differently at night, and small disturbances in magnesium or potassium inside your cells can affect how well insulin works. So the night is a window. A short, targeted routine before bed can support cellular balance while you sleep. If you're over 60 and want practical nightly tips you can start tonight, hit subscribe. I'll share simple routines that fit into 1 minute before bed. What I want you to do tonight and every night you choose to try this is follow a clear 3-part ritual: the bedtime drink, a short pre-sleep movement, and a fluid timing rule. Each part matters. The bedtime drink, the core step. Do this exactly 60 minutes before your planned lights out. Measure 8 to 12 ounces, a standard glass, of plain water. Room temperature or slightly cool is fine. Add magnesium citrate in a dose that provides roughly 300 to 400 milligrams of elemental magnesium. Most people use a powder or capsule form and check the label for elemental magnesium. If using a powder, use the manufacturer's scoop to reach that elemental range. If you're unsure, bring the bottle to your pharmacist or clinician to confirm. Add a small pinch of cream of tartar, about 1/4 teaspoon, as a modest food-style potassium source. This is a small amount. Do not substitute with a large potassium salt unless instructed by your clinician. Stir and sip slowly while seated. Don't gulp. Sip across several minutes until the glass is finished. Why these ingredients? Explain simply. Magnesium is a mineral important for cellular energy and insulin signaling. Potassium helps cells maintain electrical balance. In some people, particularly older adults who are low in magnesium or who have electrolyte shifts at night, a modest boost before bed can support overnight cellular function, and by extension, insulin sensitivity for the morning hours. That's why we pair magnesium with a small potassium source and why timing matters. Exactly when to take it. Do this drink 60 minutes before your target bedtime. The idea: give your body time to absorb and distribute electrolytes before the sleep period. Finish any substantial drinking at least 3 hours before lights out. That 3-hour fluid cutoff reduces overnight fluid shifts and minimizes nighttime trips to the bathroom that can disturb sleep and hormonal regulation. The bedtime drink itself is small enough to be allowed inside that window, but keep it to 1 small glass. A short pre-sleep movement, 3 to 5 minutes. 30 to 60 minutes before bed, do a brief, gentle activation to help your legs use glucose and improve peripheral uptake. This isn't a workout, it's a short movement ritual. Stand and do 20 to 30 slow calf raises, or sit and do 30 to 60 seated leg pumps. Press your feet down, flex and release. Or do 10 to 12 standing mini squats if you're steady and cleared to stand. This stimulates muscle glucose uptake without spiking your heart rate. For many older adults, that tiny movement before bed helps redirect glucose into muscle cells during the early sleep period. How to mix it. Practical demo you can follow. Pour 8 to 12 ounces of water into a glass. Check. If using magnesium citrate powder, use the scoop and read the label for elemental magnesium. Aim for a total elemental dose in the 300 to 400 milligrams range per serving. If your supplement lists magnesium citrate 500 milligrams, that does not always equal 500 milligrams elemental magnesium. Check the label or ask your pharmacist. Add 1/4 teaspoon cream of tartar. Stir until dissolved. The mixture may taste slightly tart. That's normal. Sit upright in a chair. Sip slowly until finished. Stay seated for a few minutes after finishing to ensure you feel steady and comfortable. Small tips to make this routine stick. Keep a measuring spoon and the magnesium container at your bedside table or kitchen counter so you can prepare it without thinking. Set an alarm 60 minutes before your usual lights out time as a reminder to prepare. If you use a cane or have balance concerns, sit while mixing and sipping. Avoid adding sugar, juice, or carbohydrate-rich mixers. This is a mineral-only drink, not a snack. Safety first. Who should not try this without medical clearance? This section is critical. If you are over 60 and any of the following apply to you, talk to your prescribing clinician or pharmacist before trying this routine. You have chronic kidney disease or reduced kidney function. Kidneys are central to clearing magnesium and potassium. Impaired kidneys can allow dangerous levels to build. You take insulin, sulfonylureas, or other glucose-lowering medications. Changes in insulin sensitivity can alter your glucose and may require medication review.
You take ACE inhibitors, ARBs, potassium-sparing diuretics such as spironolactone, amylolide, or direct potassium supplements. These raise potassium levels and can interact dangerously with additional potassium sources. You take other magnesium-containing supplements or regularly receive high-dose magnesium, including prescription treatments.
Combining sources can raise magnesium too high. You have a pacemaker or serious heart rhythm issues without recent clearance from cardiology. You have swallowing difficulties, dysphagia, or are at risk of aspiration. Sip only if you can swallow safely. Possible warning signs of electrolyte imbalance. If you try this and experience any of the following, stop and contact your clinician or emergency services. New severe weakness or muscle paralysis, lightheadedness, fainting, or very low blood pressure, irregular heartbeat, palpitations, or new shortness of breath, nausea, vomiting, or prolonged abdominal discomfort after taking supplements. Why this safety emphasis? As you age, your ability to clear extra magnesium or potassium declines in some people. Too much potassium can cause hyperkalemia, which affects the heart. Too much magnesium can suppress breathing or reflexes in extreme cases. That's why clinical oversight is essential. Medication interactions and practical guidance. If you are on insulin or secretagogues, sulfonylureas, meglitinides, adding anything that may increase insulin sensitivity could lower glucose. Not always dangerously, but it can. Check glucose more often for a few nights and let your clinician know you're trying this so they can advise on monitoring. ACE inhibitors and ARBs can raise potassium. Adding a potassium source could increase that effect. Examples include lisinopril, enalapril, losartan, valsartan. Don't combine without approval. Potassium-sparing diuretics, spironolactone, eplerenone, amiloride, plus cream of tartar increases risk of high potassium. Stop and seek medical advice before trying. If you take prescription magnesium for another reason, do not double up. Ask your pharmacist to review total daily magnesium. Monitoring and short-term checks. If your clinician approves this routine, consider these monitoring steps the first week. Check your fingerstick glucose at bedtime and on waking for several mornings to see if there's a pattern change. If you have access, check your blood pressure lying and standing to ensure no orthostatic drop after the drink. If your clinician recommends labs, periodic serum magnesium and potassium can confirm safety, especially if you have reduced kidney function. How long before you might notice a difference? This is variable. Some people report more stable morning numbers within a week. Others need consistent use for several weeks. The goal is supporting overnight cellular balance, not instant normalization. Track patterns over at least 7 to 14 nights and report observations to your clinician. Troubleshooting common issues? It tastes odd. Try using a slightly larger glass of water, 12 ounces, or chill the water. Don't add sugar or juice. I felt lightheaded. Stop the routine and contact your clinician. That could be a sign your body is sensitive to the supplement or that an interaction is occurring. My fasting went up.
Don't assume it's the drink alone. Document timing, what you ate before bed, medication timing, and share the data with your provider. Alternatives if cream of tartar isn't appropriate. If your clinician says potassium from cream of tartar is unsafe, they may suggest monitoring serum potassium and using a different plan, such as just magnesium alone at a safe dose, dietary adjustments earlier in the day, or supervised potassium salts under medical guidance. Don't substitute potassium salts at home without medical approval. Who might benefit most? This routine is aimed at older adults who tend to have higher fasting numbers or wide overnight swings, have been found to be low or borderline low in magnesium on blood work, or want a low-effort nightly ritual to support metabolic balance. Who should be cautious? Anyone with kidney disease, on interacting medications listed earlier, or with complex cardiac conditions must consult their clinician first. This is non-negotiable. Bringing this to your clinician, what to say? If you want your clinician to review it, bring the following: the supplement label showing elemental magnesium per serving, the plan to use 300-400 milligrams elemental magnesium 60 minutes before bed, and the plan to add a quarter teaspoon cream of tartar as a small potassium source. Ask them to check baseline kidney function and serum potassium and magnesium if indicated. Ask whether short-term extra glucose monitoring is advisable. Recap: the ritual in one place. 1. 60 minutes before bed, mix 300-400 milligrams elemental magnesium, magnesium citrate form, check the label, in 8 to 12 ounces water plus a quarter teaspoon cream of tartar. Sip slowly while seated. 30 to 60 minutes before bed, do a brief 3 to 5 minute leg activation, calf raises or seated leg pumps. Finish all substantial drinking 3 hours before lights out. Keep the bedtime drink small and within the allowed window. Monitor your glucose closely the first week, and check with your clinician before starting if you have kidney disease or take the medications listed earlier. Will it work for everyone? No. Not everyone will respond the same. Some people may notice steadier mornings, others may see no change. Effects depend on baseline magnesium and potassium status, kidney function, concurrent medications, and overall diet. Use it as a potentially supportive ritual, not a replacement for prescribed therapy. A quick FAQ you may have. Can I take this if I'm on insulin? Possibly, but only after talking with your clinician. You may need closer glucose monitoring for a few nights. Do not change insulin doses on your own. Is cream of tartar safe every night? For many people, small amounts on occasion are tolerated, but nightly use raises the need for clinician oversight because of cumulative potassium. What if I'm already taking a potassium supplement? Don't add cream of tartar without clinical approval. Do I need blood tests?
If you have kidney disease, are on ACE inhibitor/ARBs, or take potassium-sparing diuretics, yes, baseline and follow-up labs are recommended. Final important note. This drink and ritual are meant to support overnight cellular balance and may help some older adults stabilize morning glucose readings. They are not a cure and are not a substitute for your prescribed diabetes management. Do not change, stop, or adjust any medications without direct guidance from your prescribing clinician. If you decide to try this, bring the recipe and your supplement labels to your next clinic visit and discuss it with your provider or pharmacist. They can confirm safe doses based on your kidney function and current medications. If this message resonates and you want more practical, senior-friendly nightly routines, subscribe. I'll share more simple, evidence-minded tips you can start tonight. For the next video, I'll walk through 3 everyday foods that quietly worsen metabolic and vascular health and practical swaps that are easy to adopt. If you try the bedtime drink, tell your clinician and report back to them what you observed. And remember, safety first, especially after 60.